Hi, I'm Mark Brown. I have been live tweeting from the Quality Improvement Conference for the last 2 days. Welcome to the third and final day. I've been asked to share some of the things that I've learned and I've seen in the sessions that I attended. And I think the probably the strongest theme that's come through for me over the last 2 days has been the importance of teams and the importance of the idea that quality improvement isn't something that happens on someone's computer in their office as part of their strategic plan. Quality improvement is an interaction between people on the front line, people who have a bit of space to do some thinking, and the people it's really important for, which is the people that the quality is being improved on behalf of, which in the case of health and social care is the people who are being cared for or the people who need treatment. Today being Wednesday, no, today being Thursday, I heard from the team behind the setting up of one of London's Nightingale field hospitals at the ExCeL, and they had a massive job of starting from scratch the entire hospital at a time where it wasn't clear what was going to happen. And the thing that really stuck with me from that, apart from the massive job of getting beds and equipment and people all in the right place, was how committed they were to learning. I heard all about the role of the bedside learning coordinator as basically the person who closed the loop between challenges and difficulties happening at the hard end of delivering things and the activity to try and make those things better and to solve the problems they presented. Effectively, they were the role that closed the loop between what happens on the ground and the activity that makes what happens on the ground work better. So that role, that learning, that loop closing, whether it's through data, whether it's through relationships, whether it's through teams, through huddles, through whiteboards with loads of lines on them and bits of post-it note, the loop closing between the things that you do to try and change things and the actual impact they have is absolutely at the heart of quality improvement. And it was fascinating to hear about that happening at a time where none of us knew what was going to happen during the COVID-19 pandemic. The other thing that, the other session that I attended that really stuck with me was Farhana Rahman and Chris Tang's session on communicating COVID-19 related health information to Bangladeshi people in the UK, and the fact that straight translation of materials isn't enough to get across what those materials mean, especially not if all of those materials have been written from within a medical discourse. It's not just about changing language, it's about unpacking the ideas and the thoughts that that language contains. Like in the UK, we have been advising people who are clinically vulnerable to shield for the last year. Clinically vulnerable quite often doesn't even mean anything hugely to people who work in health services, never mind the general member of the general public. So Chris and Farhana's work was very interesting. What they arrived at was that you needed to transliterate information, not just translate it. You have to turn it into stuff that makes sense in the language of and in the lives of people that you're actually trying to help. What you need is mediators. As Farhana says, stories have stories. Everyone's well within their rights to ask you, why are you telling me this story? Where did you get your information from and who are you? So health professionals are kind of uniquely placed to be communicators of health information to the communities they live in and the communities they come from and the communities that they serve. And very much like my observations based on the first day, knowing what it is you're trying to do is the key to improving quality, and knowing who it is you are improving things for. Doing a nice poster that loads of people worked really hard on to tell a community about how to make themselves safer in the face of COVID-19. Everyone might feel great about it, might look lovely, but if it doesn't actually land with the people it's intended for, that's not a quality improvement. It's a nice bit of graphic design, but it's not a quality improvement. So thematically, again, I think teams, purpose, and also humility and curiosity are super, super important. The job of healthcare and the job of healthcare improvement isn't to tell people that they're wrong and tell people that you know better. It's to be alongside people to find ways of making the better thing happen in a way that makes sense for everyone. And I think that's the end of me for today. Enjoy your final day at the conference.